Hi there. My name is Joseph Chung. I'm an associate marriage and family therapist working at Peyton's Place Safe Space. This is an educational video about some different therapeutic modalities and figuring out which one works best for you. So, different modalities help individuals explore how therapy can help a person heal, grow, and understand yourself in a particular way. So why therapy works differently for everyone? So everyone's healing journey is unique, not one size fits all approach. Each therapy style has its own focus, techniques, and goals. Finding what resonates with you is a key to healing. So here are some commonly used therapeutic modalities. So this is one of my favorites to use. Cognitive behavioral therapy, or CBT. So this really focuses on changing unhelpful thoughts and behaviors. The techniques used are, thought logs like journaling, exposure, cognitive restructuring. And this is best for anxiety, depressions, and phobias. And it can change your thoughts and ultimately change your life. So I myself I believe I'm specialized in anxiety and depression, and so this is why I feel that this therapeutic modality works really well with my therapeutic practice, because this really focuses on changing unhelpful thoughts into positive ones. So another one is dialectical behavioral therapy, also known as DBT. So this focuses on balancing acceptance and change. The techniques used are mindfulness, distress tolerance, emotion regulation. This is best for emotional dysregulation, borderline personality disorders, and you learn how to ride the wave of your emotions. So a lot of this is through acceptance and learning how to handle or deal with the struggles you may be experiencing. So if you feel like you want to go towards more of accepting your past and, really trying to find a way to move forward in a productive way, then DBT might be for you. This is humanistic or person-centered therapy. So this really focuses on empathy, authenticity, and unconditional positive regard. So some techniques used are a lot of open dialogue, reflection, growth-based exploration. So this is really good for self-esteem, identity, and personal growth. And you are ultimately the expert on you. So a therapist that practices humanistic really has that empathy towards their clients and really trying to encourage the client to be the best version of themselves. And if you would like a more authentic relationship with your therapist, then humanistic might be for you. And this is a modality that I like to use a lot too, because I find myself addressing self-esteem, identity, and personal growth quite a lot in my therapeutic practice. So this is why I prefer this therapeutic modality. So the next one, psychodynamic therapy. So this really focuses on unconscious patterns and early experiences. So some techniques used are free association, dream analysis, transference work. So this is used for deep-rooted patterns, trauma, and relationship struggles. So you understand how your past influences how you think and act in the present and in the future. So if you are more about exploring your past trauma and really trying to connect the dots on why you act and think a certain way, then psychodynamic therapy might be for you. And I think majority of therapists use a level of psychodynamic therapy just because it is so broad. But if you really want to target, the root causes and reasons of why you're acting the way that you're acting, or they're thinking the way that you're thinking, then possibly exploring therapeutic modality of psychodynamic therapy might be for you. So the next one is family systems therapy. So this really focuses on family communication and interaction patterns. So some techniques are drawing genograms, reframing, and role exploration. So this is best for family conflict, parenting issues, or relational stress. So healing relationships heals individuals. So this really focuses on the family as a whole, and this is what a lot of marriage and family therapists focus on the family or the environment or the structure that the client is experiencing or living with, and really trying to make changes on the interactions that this person may have with their family or close members within their social circle, and really trying to address the bigger picture of why a person may be experiencing some mental distress. So the next one is solution-focused brief therapy. So this is something I like to use myself. So this really focuses on your strengths and solutions, not your problems. So some techniques used are asking miracle questions, scaling, or goal setting. So this is really good for motivation, short-term goals, practical problem solving. Focus on what works, not what's wrong. So the reason why I really like this therapeutic modality is because it's really goal-oriented. And I think part of growth and development is to have very specific goals that's attainable to, make a person feel fulfilled and that they're accomplishing, their small goals throughout their day or throughout their week. And I am a firm believer that a lot of small accomplishments will add up into a big accomplishment. And so really focusing on solution focus, developing a plan, having goals in mind, maybe taking some assessments to see the progress of a person's progress within therapy. It might be really good for those who are really goal-oriented and solution-focused. So this is another one of my favorites, solution-focused therapy. So this next one, integrative and mindfulness-based therapy, is combining approaches with mindfulness and flexibility. So techniques are breath work, grounding, present awareness. So this is best for those experiencing stress, trauma, anxiety, and burnout. And so it really focuses on be where you are. That's where change begins. So just really accepting the present moment and really trying to gain control of your thoughts and emotions despite any hardships or struggles you may be experiencing. So mindfulness based therapy is another really powerful technique that I like to use with my clients to really help them focus on the present moment through breath, grounding, mindfulness, awareness. And another one is eye movement desensitization and reprocessing, other known as EMDR. So this really helps focus the brain on reprocessing traumatic memories safely. So some techniques are bilateral stimulation, eye movements, tapping, or sounds to reduce emotional stress. So this is best used for trauma, PTSD, anxiety, and intrusive memories. So reprocessing the past to heal in the present. So a lot of times with trauma, it's really hard to remember the past and really have the dedicated time and space to be able to process all the traumas that happened. So this is really good for those experiencing significant trauma or PTSD, because according to the theory is that with the eye movement desensitization, with the tapping and the sound, it's trying to activate the logical mind to balance the emotional side of the mind. So when a client is processing really emotional experiences and memories, the logical side will help balance it out and reduce the level of intensity that the person may be feeling. So this is really good for those with significant trauma and PTSD. So those are some commonly used therapeutic modalities. Of course, there's more, but this is usually what clinicians use to treat mental illness. So which one works best for you? Well, that depends. What are you looking for? What are you comfortable with? What are some of the struggles you're experiencing? What are some of the goals you want? So here's a little breakdown of it. So if you need structure and skills, CBT or DBT is best for you. If you want deep insight, psychodynamic or EMDR might be good for you. Seeking connection and empathy, humanistic is good. Healing relationships, family systems, or want fast practical change, solution-focused therapy. So in conclusion, every therapy type offers a unique path to growth. So the right modality is a one that meets you where you are. So if you enjoy this content and you're interested in more, please subscribe to the channel. And if you're interested in some mental health services, feel free to reach out to the channel, send a message and we'll get you connected. We are based in California, so that is a requirement to be located in California. Well, thanks for listening, and I hope you learned something new that will help you with your growth to recovery. And I hope you all have a great day. Bye.